Are you going to teach your kids to become physicians?
Yeah, I'm not going to force Ari to do anything, but I might just like tape a bunch of surgical instruments to her hand where she can't remove it. So if she can figure out her daily functions through surgical instruments, like eating lunch, cleaning up after herself. I'm kidding. I don't force her. Like, she says she doesn't like blood. She's 12. I respect that. I don't think that that's going to last as a feeling. As a profession, I don't know, because the recent reports show that your CPI inflation index shows common goods, rent, food growing 10 to 20% over the last 5 years. And I think it was 5 or 10 years. And physician reimbursement on average has decreased close to 8%. It's like 7.75%. So if it's for the money, definitely not. If it's something you like doing, go for it. But I think even more, like, since you've been in training or you were in training, like, how many people do you see like work their butts off to get like their ideal training spot, and they just drop out? They go completely like left field. You're like, I did not see that happening. Like, oh, okay, you got into orthopedics at Harvard, and like, I'm going to go on the business side of things. Stuff that's not even like, you don't even need like a medical degree for. I really don't care. Whatever she wants to do, I'm going to back. And because if she wants to do something, she's going to be better at it, because she's got that inert drive. Yeah. So as far as like pushing kids to do something for your gain, I don't agree with.
How about college? Are you pushing her to go to college?
Sarah and I just had a fight about it, because I was trying to make a point with Ari, like, you find a really good idea, you want to pursue it, I'll back it. And you don't really need to go to college. And I heard it that night when Ari went to bed. It was like, this is something we need to talk about and agree on before you tell Ari you don't need to go to college. I'm like, but it's kind of true. Like, do you really need to go to college? Yeah. Going to a good school now is like 60 to 80 grand a year, counting living expenses. And then med school is another 80 to 100 grand a year.
At least like med school, you learn stuff that you use, right?
More relevant stuff.
Compared to college, which was like, I don't know why I'm taking these courses, but well, for you took a lot of courses that you probably like.
I dropped out before the semester was over, so it dropped the bill a little bit and it extended my undergrad stay.
Ram, I know you're young and your son's like almost 2, but like, have you like talked it over with your wife about like what you would do? Would you tell him to be a dentist? Would you tell him to be physician?
I think I would probably.
That dude smashes a lot of shit.
He does break a lot of stuff. He's probably going to be a boxer. But no, I definitely thought about it. I don't know. We don't really have much time to talk, I feel like, nowadays with the wife. But mostly from my perspective, it's similar to Rod, where I'm just like, whatever he wants to do and it's something he enjoys doing, that's ultimately what I want him to do. Yeah. And if he wants to become a doctor, I obviously will guide him and let him do that and tell him to go for it. But at the same time, I will definitely warn him against, you lose your 20s and you're legit. Like, I love what I do now, but there's a lot of people that I know in a lot of fields within medicine. If you just look at suicide rates, other rates of lifestyle, things like that they go through all this expecting something at the end. And then the end comes and they're like, oh, I just gave up everything. And now I don't really have an out. And now I'm stuck. I have to do this, And that's the part that's like, you guys told me many times early on, you guys told me, you're like, dude, if you want to do this, make sure you want to do this. And, that's why it took me 5 years to end up doing it in between school, which I respect and I'm happy about, because it's like, make sure you want to do it. It's very rewarding if it's what you want to do. Yeah. But there's so many other things. It's not just go become a doctor because of the thought of becoming a doctor.
Prestige isn't there anymore. And like, well, with more private practices closing down or not closing down or turning over to becoming hospital employed or run by private equity, like you become an employee, you might not be shoved in a cubicle, but like when they tell you got 15 minutes to see your patients and you got overhead bosses, that kind of removes everything from you, right?
Independence is kind of dead.
Yeah.
So like
you don't get to make your own mind. And the patients think it's your fault when we don't have that issue. We're in a different atmosphere, but like mainly talking about like, especially the primary care aspect. One thing is like physicians are getting burnt out more. And once they get burnt out, they don't really care about what they do with the patients, about like having to see the patients to keep their job.
A lot of times coming back to what he said, like the amount of effort they put, like, and now they're like kind of like trying to force themselves to be like, this is who I identify as. Yeah. This is my label. This is who I am. This is part of who I am, my personality. Subconsciously, like it's like a self-fulfilling prophecy where you just keep doing it for the sake of doing it because you feel like you've been told to do it and you worked so hard to get there that you just kind of like make it work. And it's not best for your patients, but you just kind of like one day to the next and just roll with the punches. And if they don't like it, they go to somebody else. Yeah. And a lot of people have difficulty getting access to physicians, quality physicians. So like you really don't have people to turn to, and it's going to be less and less.
And like today I was reading an article, it was on Medscape, and it was like nurse practitioners and PAs, like quiet quitting. That's what they called it. And it's kind of like this whole burnout situation. They're not getting respected by like the medical assistants and other staff in the office. They don't get respected by their bosses, which are usually the physicians, but sometimes it's the non-physicians, the managers that aren't as educated as the physician assistant or nurse practitioner. They're just going to see these patients and it's just motions, like for 15 minutes, like they just get them out the door. They're like, all right, we got to just get these people through. And we have the patients that come in and we just sit down and talk to them, and like, they complain about some of the primary care physicians, and because I go through all aspects of like trying to get them healthy and, when they need surgery to be part of that, to make that difference, because it all out, it just makes me feel better than just, being like, no, you just need to get out.
You're another human being. I'm a human being too. Surprise. I care about how you're doing overall. It's that aspect's gone. It's becoming more regimented and more ridiculous. As far as like, it's a job, getting the job done.
For me to answer this, I'm not going to force my kids to go. If they want to do it, I don't know. My son might do it because he thinks there's girls in the office all the time. That's what he's interested in at the age of 3. He always wants to go to the office with me, but I'm not going to force him. Like if he's passionate about something.
Yeah, that's the thing. It's like realistically, let's talk numbers. Like how is this scene evolving? And what you want to do and why you want to do it. Like if you're doing it for your name, for salary, whatever, is like wake up. This is old school mentality. This is not like real life.